And thanks to everyone for attending this talk. So the title that I've chosen is a fairly simple question: are the lungs built for exercise? And I've sort of chosen this topic because, one, it's my area of expertise, and two, I think during this this global pandemic of COVID-19, we're thinking a lot about our lung health, and particularly in the context of exercise. So my goal essentially is going to be to answer this question, but really to give you an overview of some of the respiratory factors that might sort of influence your ability to exercise. And I sort of want to emphasize that, many of these factors are relatively minor, and not to spoil the sort of punchline, but the lungs are really good at exercising. So just press go here. So I'm going to break the mold a little bit and just start with my conclusions. And so I hope to, by the end of the talk, convince you of the following. So one, for most individuals, the lungs are actually overbuilt for what we need them to do during exercise. There are obviously a few exceptions. You can think of highly trained athletes like marathon runners, or even individuals with chronic respiratory conditions, which is unfortunately all too common. There are many factors that can actually affect our ability to exercise in terms of the respiratory system. But generally, the lungs are not really the weak link. It's usually your muscles or your cardiovascular system, such as your heart or your blood vessels. There are things that we're going to discuss during this talk, like airflow limitation, or the energetic cost of breathing, or how much oxygen is in your blood, and even feelings of shortness of breath that can all have a sort of detrimental impact. But for the most part, again, the respiratory system is not the reason you would stop exercising. The last thing is that exercise training, which of course you're all involved in to some degree, can actually reduce a lot of the influences of these respiratory factors, and can be really helpful. So it doesn't usually improve the function of the respiratory system, that's exercise training, but it can reduce the demand that we impose upon it during exercise. Okay, so just as a bit of an overview, the respiratory system has a few main components. So obviously the lungs that are going to allow for efficient transfer of oxygen from the air into our blood, and carbon dioxide from our blood into the air. There's the airways that are going to conduct that air down to the alveoli, which are sort of the functional units of the lung, where gas exchange of oxygen and carbon dioxide occurs. And then there's the rib cage that's sort of going to encase the lungs and airways and protect them. And finally, the respiratory muscles that are kind of be the pump that's going to drive airflow, so allowing for air to move in and out of the lung freely. Now, there's lots of functions that the respiratory system fulfills. I'm doing one of them right now, which is phonation. I'm speaking. It's obviously involved in smell, or the olfactory system. And as we know, again, due to the COVID-19 pandemic, we're all too aware of its role in the immune system. However, I'm not going to focus on much of that. I'm going to focus really on this last point, which is the diffusion of oxygen into the blood and carbon dioxide out of the blood, which is very, very important during exercise. And the reason I say that is that we utilize oxygen to fuel our muscles and produce carbon dioxide in turn. And the respiratory system is intimately involved in that process. So when you think about the respiratory system, throughout this talk, I want you to think about the concept of demand and capacity. And I'll define each of these terms just so that we're clear on what we're talking about. So what I mean by demand is that our bodies are continuously using oxygen, and we're continuously producing carbon dioxide. And essentially providing enough oxygen to these tissues and clearing that carbon dioxide is the main role of the respiratory system. And in order to do this, we need to move air in and out of our lungs, and this is referred to as ventilation. Now, during exercise, we obviously need more oxygen, and we produce a lot more carbon dioxide. And so what that means is that we need to increase our level of ventilation. And so I've included a graph here, and apologies if it's not super large, but on the horizontal axis here, you have exercise intensity. So imagine somebody on a bicycle exercising, and the intensity is increasing and increasing and increasing. And what you would see if that occurred, you'd see ventilation increase. So you can see that on the vertical axis here. And it goes from a pretty low value at rest, and then it increases quite extensively during exercise. So that's evidence of what I was describing here. We need to ventilate a lot during exercise. And an analogy to this is kind of like your car. If you're on the highway and you're pressing on the accelerator, the demand that you're incurring on your respiratory system is just how hard you're pressing on the accelerator. You know that your car can handle it. You can go, let's say, to 100 kilometers an hour fairly easily, and you can even go faster if you need to. But essentially, the amount of ventilation that you're incurring on your respiratory system is that demand, and it goes up during exercise. Now, the capacity of the respiratory system is a little bit different. So our respiratory systems have a finite capacity. So think of the size of the lungs, how much air they can hold, how much airflow you can generate maximally, how much blood is flowing through the lungs, as well as the strength and endurance of your respiratory muscles. These are all indices of what we would refer to as the function of the respiratory system, or its capacity. And you can measure this with specialized equipment. And some of you may have had experience with this at the hospital. But in essence, you can see here on the bottom right is a respiratory therapist conducting respiratory function tests in a patient. And obviously, the values are going to vary between individuals. Some individuals might have very large lungs, some might have smaller lungs, but there is a fairly normal range. Now, this is going to be determined by a lot of factors. So the age of the individual, their sex, height, weight, as well as exposure to various environmental sort of pollutants or irritants. So think of pollen or even smoke, pollution, etc. And also our genetics. So if your parents have very good lung function or respiratory function, you're also likely to have very good lung function. So there's certainly an element of heredity. Now, the analogy here, if I could borrow the car analogy again, the capacity of the respiratory system essentially is the highest number on your speedometer. So you know that many cars, when they're brand new, can probably go up to 200, 220 kilometers an hour. You rarely ever go to that point, but it's technically possible, I suppose. So our lungs have a very large capacity, particularly when we're between the ages of 20 and 30. So again, I've defined the concept of demand and I've defined the concept of capacity. And just as a reminder, the demand that you're imposing on your respiratory system is your body's metabolism. So the more oxygen you need, the higher the demand on the respiratory system is going to be. And its capacity would refer to its function. So how big your lungs are, how much airflow you can generate, etc. So take a group of adults above the age of 40. Let's imagine that we're all sitting here at rest. We have a low metabolism. We don't need very much oxygen. So our ventilation right now is about 10 liters a minute. We're moving 10 liters a minute in and out of our lungs every minute. Our maximum ventilation, again, in a group of healthy adults above the age of 40, is often up to about 100 liters a minute. Sometimes it's even up to 200 liters a minute, depending on the individual. So really, what you can see here is that if I could borrow the same kind of analogy here of demand versus capacity, is that the demand is very low, 10 liters a minute, whereas the capacity is very high, 100 liters a minute, which means that you're not using very much of your lungs while you're sitting here at rest. So again, think of driving your car, going about 20 kilometers an hour, 30 kilometers an hour like you would in a school zone. Now let's take an example where we're exercising, where you now have an increased metabolism because you need more oxygen to fuel those exercising muscles. And let's say you're biking, or just because it's winter, you're cross-country skiing or skating along the riverway. You would have a much higher ventilation, again, because you need more oxygen to fuel those muscles. And again, on average, in a group of adults above the age of 40, at maximal exercise, so the highest intensity you're capable of, ventilation might be as high as 60 liters a minute, which is quite a fair bit above rest, but nevertheless below the absolute capacity. So again, the capacity doesn't really change just because you're exercising. It's about 100 liters a minute on average in this healthy population that I'm describing. So here again, demand is a little bit higher, but the capacity still exceeds it. So 60 liters a minute of demand versus 100 liters of capacity. It would be, again, analogous to driving at a high speed on the highway, say 100 kilometers an hour when you can go much faster. So really, your lungs are capable of breathing or moving more air if you need to. But even in most individuals, we don't ever need to get to that point during exercise. So the respiratory factors that are going to impair exercise capacity are what I'll discuss next. So the lungs are really good at moving air, but they're not perfect. So what happens in a situation where the demand meets the capacity or even exceeds it? What's going to happen in that scenario? Well, you can get situations where you have what's referred to as airflow limitation. And this is something that commonly occurs in individuals that have asthma or obstructive lung disease. But it can also affect healthy adults. So our airways, kind of like the highway, only allows a certain amount of airflow, or in the highway analogy, traffic. And airflow limitation can be triggered by intense exercise, and it can often be worsened by things like environmental exposures, such as the cold, or irritants such as smoke or pollution, etc. So this is a bit of a crude diagram here that on the right-hand side that shows you, and I'll use a laser pointer just to be clear. The speed of airflow is on the vertical axis, and then the volume of air that you can contain within your lungs is on the x-axis. And this gray line essentially represents a person's maximum capacity to breathe. They can only breathe within this area. So while we're all sitting here at rest, we're taking small breaths in and small breaths out, and they're relatively slow. The speed of airflow isn't particularly high. Now, let's say you exercise and you're experiencing airflow limitation. It would look something like this: much bigger breaths that are much faster. And what I'm highlighting here with my laser pointer is an area where you're reaching the maximum capacity of your lungs to breathe in your airways. So that would be a situation where you're experiencing airflow limitation, and that can reduce your ability to exercise. It doesn't stop you, but it can reduce the intensity at which you're exercising. Another thing would be the respiratory muscles. In order to breathe, your respiratory muscles actually have to work quite hard. So if you need to breathe lots of air, your respiratory muscles are going to have to work that much harder. I'm using the analogy of there's no such thing as free lunch, because often we think of exercise as working our leg muscles or our arm muscles or whatever muscles are involved in the main movement that we're conducting. But we often forget that our breathing muscles have to work quite hard as well, and our hearts for that matter. So having a high respiratory muscle work means that a lot of our energetic resources, so the amount of oxygen we deliver to those muscles and how much blood flow we deliver to those muscles, has to be very high. And at maximum exercise in healthy individuals, it can be as much as 10 to 25%. So a lot of work is being done by those muscles, and they can fatigue just like our regular muscles. Now, another thing that can happen, and this is a relatively rare phenomenon, but it does occur, is reduced blood oxygen levels. So if you're exercising and you're trying to send oxygen to your muscles, and they're using that oxygen, it's possible that you can't provide it quick enough. And so even in healthy individuals, you can see small reductions in the amount of blood that's contained or amount of oxygen that's contained within your blood. And just using this laser pointer here, you can see that on the vertical axis, there's a measure of blood oxygen levels. And in males and females, it goes down a little bit as a function of the intensity of exercise. So on the horizontal axis, you just have a measure of how close you are to your maximum intensity from 0 to 100. So it's a small reduction, but it can also impair exercise performance. Now, one last respiratory factor that I'll discuss is the notion of shortness of breath. And I'm sure we're all familiar with this phenomenon, just having exercised before. And it's described as sort of the feeling of breathing discomfort. And a term that's often thrown around is dyspnea, but I like shortness of breath because it makes a little bit more sense intuitively. But when people experience this, it leads them to often reduce the intensity of their exercise or even avoid exercise altogether. And the exact causes aren't particularly clear, but they may be psychological or physiological, but we know it happens, even in health and individuals that have respiratory disease and even in elite athletes. So this graph here that's on the right-hand side shows you that quite clearly. So here you have dyspnea, or a measure of breathlessness on a scale from 0 to 10. And on the horizontal axis here, you have just a measure of exercise intensity. In this case, it's on a bike. And you can appreciate that the perception of breathlessness increases as a function of the intensity of exercise. The harder you're working, the more short of breath you tend to feel. So all of these things together can lead to a reduction in the ability to exercise. But I really want to emphasize that their influence is relatively minor. It's not going to stop you from exercising. It's just going to make it slightly harder. So one thing that I want to point out is that we're all aging, unfortunately, and these respiratory factors, it's possible that they become more prominent with advancing age. And I want to give you an overview of the influence of age on all of these factors. So from 30 years of age and onwards, our respiratory function is going to decline progressively. So what this is going to do is reduce our capacity, as I've highlighted prior. However, our physical fitness also tends to decline with age, but this is going to reduce our demand. So what might that look like if we look at somebody going from age 20 up to age 100? This is a graph that's based on a large amount of data from Europe. And the first graph here on the, I'll use my laser pointer just to be clear, on the vertical axis, you just have a measure of physical fitness. And on the horizontal axis, you have age of the individuals. On the second graph, you have on the vertical axis, a measure of respiratory function. And on the horizontal axis, again, age. And these are the same individuals. So you can see that these lines sort of go down in parallel on average again. Some people will go down at different rates, but the idea here is that it's fairly consistent on a population level. So what that means is that as you age, you have a reduction in demand on average because physical fitness tends to decline a little bit. And the capacity of the respiratory system will also decline. But the main thing I want to highlight here is that even with advancing age, the demand on the respiratory system will still be lower than its capacity. Our lungs are still capable of responding to the demands of even the most intense exercise. So again, regardless of age, the lungs are really, really good at meeting the needs of oxygen and CO2 clearance during exercise. Now, I think I've made the case that certain respiratory factors can have a negative impact on our ability to exercise. But who's going to be the most susceptible? So far, I think I've tried to convince you that healthy individuals really are mostly spared from these factors. Doesn't mean they're not there. Their influence is quite small. Individuals who really have a hard time with this are highly trained athletes. So they're capable of exercising at very high intensity. So imagine Eliud Kipchoge here, who's the world record holder in the marathon. So he can run 42 kilometers in just over 2 hours. That means that the demand on his respiratory system is going to be very high. But unfortunately, he has lungs that are no different than a non-marathoner, or at least there's no evidence of that. So really here you have a situation where those respiratory factors become very important. Now, patients with chronic obstructive disease or chronic respiratory disease, they tend to have the opposite issue. And basically, what that means is that their condition, to a variable extent, reduces their respiratory function. So they have a lower capacity, but they also have a lower demand because they tend to be, they have a lower physical capacity than, say, a marathon runner, for example. So in this scenario, you have a lower demand and capacity, and they can be close to one another. So those respiratory factors become a little bit more important. Now, even in these instances where you have a close connection between demand and capacity, or even a situation where demand exceeds capacity, the respiratory system still isn't the weak link in the vast majority of cases. And by weak link, I mean the reason why you can't exercise anymore. It's often more related to your heart, your blood vessels, and the strength of your muscles. So next, we're going to talk about the benefits of exercise from a respiratory standpoint. So really, what can we do to decrease the influence of these respiratory factors? And I'll try to be as practical as I can here. So exercise training is something that you're all engaged in. And the idea here is that you would have benefits that extend well beyond just the respiratory system, but many systems in your body. Unfortunately, the lungs, unlike the heart or the muscles or the blood vessels or the brain, don't really respond to training that well. You're born with a certain set of lungs and they grow. And once you reach peak growth, their function will decline slowly with age. So even if you're very fit or very unfit, or you've exercised your whole life, or you just started, really you'll have those same set of lungs, and you can certainly reduce their function by smoking or being exposed to environmental pollutants, but it's very difficult to make them better. Even with very intense regular exercise, your lungs don't really get better, which is an odd thing to think about. There's some exceptions, obviously, such as swimmers. But really, for the most part, chronic exercise training won't have a huge effect on the respiratory system. But the benefit here, and this is sort of a good news, bad news thing, is that when you train, you're going to improve a lot of other systems, including your muscles and your heart. And that's going to improve their efficiency, so to speak, and reduce the demand on our respiratory system. So for example, if you train and you become a little bit fitter and you exercise at the same intensity, the amount of ventilation that's needed to sustain that exercise will be lower after training than before, which is a very good thing, but it makes it easier for your lungs to do their job. So what are some practical approaches that you can employ to sort of maximize this? Well, you might have heard about this in a previous talk, but interval training is a really great way to do this. So again, this is sort of a paradigm where you would exercise at very high levels of intensity, and then alternate that with bouts of low intensity, and keep on doing that in a kind of cyclical fashion. And you can see that on the bottom right here, where you have the intensity of exercise varying in red over time, in contrast to in blue, where you see just a normal sort of constant intensity of exercise. So there's evidence that this helps reduce the load on the respiratory system, and it helps avoid some of those respiratory limitations. So although you're exercising at this high intensity, you're only doing so briefly, and so the load on the respiratory system is quite low. And so there's some evidence that that helps with things like breathlessness, as well as the other respiratory limitations that I've mentioned earlier. Another sort of less obvious approach is to train your respiratory muscles. So your respiratory muscles are very important. They help you move air in and out of your lungs. And in the same way as you would train your leg muscles or your arm muscles, you may also want to use an approach to train your diaphragm or the other muscles that are involved in respiration. I won't go through them all, but they're on the slides here. So again, it's sort of like lifting weights for the muscles of respiration, and it's definitely going to reduce feelings of shortness of breath. And there's some evidence that it may even improve exercise capacity in general. So the last few slides that I have are just, I'm going to use fairly extreme examples because I like to exaggerate for effect, but individuals who are very highly trained, or individuals who have chronic respiratory disease, from a respiratory standpoint, have actually similar problems where the demand and capacity that's imposed on the respiratory system is quite close, and sometimes the demand can even exceed it, which makes exercise quite difficult from a respiratory standpoint. So one question you might be asking yourself is it even possible to exercise with chronic respiratory disease? And I want to emphatically say yes. So this first case is, I've labeled her Jane Doe just because it's in a published scientific article, but this is an 86-year-old female with chronic obstructive pulmonary disease who developed this condition after 30 years of secondhand smoke exposure. And after getting tested by her respirologist, had quite low respiratory system function, so about 34% of predicted values. The average would be 100, of course. However, this person actually has tremendous physical fitness. So they were able to continue exercising despite their condition, and their physical fitness is actually 175% of what you would predict, almost twice as fit as the average population. When they're asked about their shortness of breath during exercise, they really only rate values that are low to moderate. So 3 out of 10 on a scale that's from 0 to 10. And this individual actually has gone on to hold multiple national and world age group swim records. So the key point here is that despite having quite severe and advanced respiratory disease, they're still able to train their muscles, their heart, their vasculature to, again, take a little bit of the load off the respiratory system and still have quite a high level of function. So here's another 2 examples, a little bit of a different approach, but similar idea. So these are 2 individuals, Marc Jung and Philippe Poncet, who are both individuals who have chronic obstructive pulmonary disease, like many individuals. So this is a scenario where they were actually working with Philips, which is a medical devices company. And essentially they were given devices that allowed them to breathe additional oxygen while they exercised. And what this allows them to do is actually exercise at a much higher intensity than they usually would be able to. And then they can derive the benefits from that exercise. So here's an example of the little device that weighs about 5 pounds. And they can place that in their backpack, and that will certainly help them out when they're exercising. So let's revisit those take-home messages again. For most individuals, the lungs are overbuilt for the demands of exercise. We're well endowed with large lungs that are capable of moving large volumes of air, and this is true throughout the lifespan. I hope I've convinced you that there are many respiratory factors that can affect our ability to exercise, but they're rarely the weak link. Often it's more the inability to exercise or difficulty exercise is more related to other systems such as the muscles or the heart. And finally, exercise training can be used to actually mitigate the influence of some of these respiratory factors for those that are experiencing them. And again, I mentioned the approach of interval training or even respiratory muscle training as a practical way to do this. So really, if I was to answer the initial question that I asked, are the lungs built for exercise? I hope I've convinced you that the answer is yes, and you can tell all your friends. And with that, I'd just like to invite anyone who's interested in asking a question or providing a comment to please do so. I've also added my email here. If you have any questions after the fact or you want to get in touch, I'd be more than happy to answer any questions. And I've also sent these slides to Rhea, and again, you're more than welcome to having them if you want a bit of a refresher. So thanks so much for having me, and like I said, I'd be more than happy to answer any questions you might have.
We have a question from Kevin Boreski, so I'm just going to get him to unmute.
Hi, thank you very much for the informative talk. I really enjoyed that.
Not a problem. Thanks.
My question's a bit more theoretical. In general, the body's pretty efficient and creates efficiencies as needed. But like, as you've talked about, the lungs just about always can overmeet the demand that they'll ever face. So evolution-wise, I was wondering what like the rationale for that was. Is it mainly just that we can't really change how much air we can take in, only the efficiency of how we use that oxygen?
That's a good point. I mean, I'm not an evolutionary biologist, so I'll reserve the kind of teleological discussions for another time. But I would say that if the lungs are kind of the first line of defense in oxygen transport from the air to the muscle, and so if it wasn't well designed to do that job, then it would be quite difficult to do anything. So I don't think it's entirely surprising that our lungs are overbuilt relative to, say, other systems. What's always been confusing to me, though, is that they're difficult to train. Their capacity is difficult to increase. So, yeah, I mean, again, I think it's a very interesting point, and I don't have a direct answer for you, but it's certainly something that is going to be something that we'll be asking ourselves for a very long period of time.
Thank you.
No worries.
I have a quick question, and my Zoom call kicked me out, so I'm sorry if you talked about it at the front. I had to.
No, it's okay. Happy to repeat.
So you made reference to that swimmers had the ability to expand, and that one woman that had success was a swimmer. Is there more evidence? I mean, I can make guesses, but what's from your findings? What's the reason that sport or that environment is what affects your lung capacity?
So that hasn't been answered yet, as far as I know, but swimmers consistently have larger lungs than the general population. But then you sort of have to ask yourself, is that the chicken or the egg, right? So are swimmers just self-selecting swimming because they have big lungs, or is swimming leading to them having larger lungs? So a bit tricky, but you can imagine that if your torso is submerged in water, the amount of work that your respiratory muscles have to do is quite high. And so there might be some forces that lead to an expansion of tissue, perhaps, but certainly swimmers tend to have quite good lung function. There is one caveat, though, is that breathing chlorine can be quite an irritant to the airways. And so often asthma is a condition that many swimmers develop or have issues with during their training. So it's certainly not just a good thing. It can be equally bad just because of that exposure.
There's a question from one of our viewers saying, please give an example of respiratory muscle training.
Yeah, that's a very good question. And then apologies for not making that a bit more clear. So I'm just going to go back a few slides just so that you can see the device that I'm going to mention. But this is a commercially available device that you can sort of purchase. Some of them are very inexpensive. Some of them are more expensive, just depending on the application, kind of like a normal piece of sports equipment. But the idea is that you're breathing against a resistance. So imagine exercising with a straw in your mouth as opposed to breathing through a larger orifice. It'll be a lot harder to breathe. So the idea is that you have to generate more pressure in order to breathe air, essentially. So again, it's kind of an odd thing to think about, but it is something that's employed quite a bit with patients with chronic respiratory disease to, again, increase the capacity of those respiratory muscles. But again, it doesn't necessarily need to be overly complicated. Anything that gets those respiratory muscles working is a good thing.
Does the temperature of the air matter?
Yeah, so I mean, I went for a run yesterday in -25, and breathing was quite difficult. So yeah, the temperature of the air is definitely an important factor. And unfortunately, cold, dry air, which we're all too familiar with here in Winnipeg, is something that can cause your airways to narrow a little bit. And that can make it harder to breathe during exercise, and that's true for certain individuals more than others, but it is something to consider for sure.
One more question coming in.
Sure.
Kevin, go ahead, Kevin.
Building on that, I think I've read before. Like, I know that a lot of cross-country skiers have amazing VO2s, and again, maybe a bit of a chicken and the egg thing, similar to the swimmers. But I think I've also read before that there's a surprisingly high prevalence of asthma potentially in some cross-country skiers. So kind of building on that exercising in the cold, I was wondering what your take was on like doing a lot of cardio in extreme cold and the effect on the lungs, more chronically as opposed to just acutely, like you had mentioned.
Yep. So there's a term for ski asthma, which is something that a lot of cross-country skiers develop. And it's certainly not something you'd want to have, and it's for a lot of these athletes almost unavoidable. I wouldn't say that the average kind of recreational cross-country skier is likely to experience to the same extent. It would really be when you're starting to log substantial hours training in these very dry and cold conditions. And again, that's probably something that might occur in Winnipeg, certainly due to the conditions in the winter. But regarding their fitness tends to be remarkably high. But again, it may come at the cost of impairments in the lung that may cause problems down the line. I wouldn't say necessarily that it would be as bad as, say, a typical severe case of asthma, but it can certainly be debilitating for sure. And these individuals may want to use bronchodilators or medications to dilate the airways prophylactically to sort of avoid the constriction that often happens.
Interesting. Thank you.
All right.
Is there any other questions or comments from any of the other participants? Oh, my Zoom meeting kicked me out. What is going on tonight? Just in case I get kicked out before, I will say thank you for doing this, and sorry I didn't give you a better intro.
No, not a problem. Happy to
I don't know. It was weird how it kicked me there. Panicked, I won't lie. So if anybody else has any questions, feel free. If not, we will call it an evening, and it was a great evening. Again, thanks. That was a great talk. I learned a lot. It was a good refresher for me from some of the stuff I learned many, many years ago, and definitely some new stuff. And we hope everybody tunes in on Thursday to learn a little bit more about what's called polypharmacy, which should be an interesting talk. And you can head to the Jets game. I'm not even sure the score. So have a great night, everybody. Stay warm. Hopefully the weather gets a little warmer and we can do some more activity outside.
Absolutely. Thanks so much, everybody. Take care.
Good night.